When Laura Ralph gave birth, there were serious complications.
At one point, I was worried that my son might die and that I might die.
When labor stalled, doctors used forceps to deliver her son. Ralph suffered a pelvic floor injury that she still lives with 7 years later.
It's changed my life and quality of life. It was really hard on my mental health.
Forceps and vacuums are often recommended as an alternative to C-sections, which can have risks. More than 35,000 babies are born each year in Canada with the use of these instruments.
We have relatively higher rates of forceps use than other places, and forceps have a higher risk of these injuries than vacuum.
The lead author of a new analysis in the British Medical Journal says the rates of injuries are absurdly and unacceptably high. According to the research, Canada has had the highest rates of maternal trauma during forceps and vacuum deliveries when compared with other high-income countries since 2010.
There are some European countries who have abandoned forceps altogether because of the issues with maternal trauma. And so I think that's one reason why we're seeing these higher rates, that we continue to have these high rates of forceps deliveries.
This obstetrician says proper training is key.
For any obstetrician to be able to use those instruments, you must meet very strict criteria.
She says it's important for patients to know their options so they understand the risks.
We should also empower women very early in their pregnancy to be able to choose, do I want a cesarean birth or do I want a natural birth?
The researchers behind this new analysis say it can be difficult to make informed split-second decisions while in labor. But more thoughtful discussions between patients and their care providers before a baby is born could make a big difference. Idil Musa, CBC News, Toronto.